There is a forgotten Korean tea that kills harmful gum bacteria, and your dentist has never mentioned it. Her name is Mrs. Park. She was 67 years old, a retired school administrator from Incheon who had been living in the United States for over 20 years. She came in not for a cardiac emergency, but because her cardiologist had referred her after flagging an unexpected finding. Her inflammatory markers were elevated, and no cardiovascular cause had been identified. She had been told her gums were a little inflamed at her last dental visit. She had been using mouthwash twice a day for years. Nothing was getting better. What unlocked it for her was not a new prescription. It was a tea her mother had made her rinse with as a child in South Jeolla province. That is what today is about. Don't look at your mouthwash. Look at what your mouthwash cannot reach. Most people believe that if they brush twice a day, floss occasionally, and use an antiseptic mouthwash, they are doing everything necessary to protect their gums. That belief is exactly why periodontal disease is the most common chronic infection in adults over 50, and why most people have no idea they already have it. Here is the silent threat. The bacteria destroying your gum tissue and the bone beneath it are not living on the surface of your teeth where your brush can find them. They are living in the space below your gum line anaerobic bacteria, meaning they thrive without oxygen, in a protected pocket your mouthwash floods but does not eliminate. And here's the problem with flooding. Your mouthwash kills everything. The harmful bacteria and the beneficial bacteria both die. Within 4 hours, your mouth recolonizes. And the anaerobic pathogens, the ones specifically adapted to that low oxygen pocket below the gum line, come back faster than the beneficial ones. You are not losing this battle because you are not trying hard enough. You are losing it because the tool you are using does not make the distinction that matters. By the end of this video, you will know exactly which Korean tea, what dose, what water temperature, what timing pattern, and what specific rinse technique delivers the active compound directly to the bacterial pocket below your gum line. You will also know what to do if you are on a blood thinner, because that question is almost never answered, and it needs to be. Most people will never hear this from their dentist. Not because your dentist is withholding it, but because the active compounds in Korean green tea cannot be patented. When researchers began publishing data confirming that these compounds selectively kill the 2 specific bacteria responsible for periodontal disease, there was no mechanism for a pharmaceutical company to own that finding, no incentive to fund large-scale trials that could move it into Western dental treatment guidelines. Without guidelines, dentists do not recommend it. And a tea that Korean traditional medicine has used for oral hygiene for centuries gets dismissed as folklore, until 3 separate human clinical trials confirm it, and the evidence becomes impossible to ignore. Here's the fact that should change how you think about your oral care routine. You can use antiseptic mouthwash every single day for 20 years and still develop advanced periodontal disease, not despite the mouthwash, but partly because of it. By eliminating your beneficial oral bacteria alongside the harmful ones, broad-spectrum oral antiseptics create a recurring vacancy that the most aggressive anaerobic pathogens are best equipped to fill. The mouth is not sterile territory. It is a bacterial ecosystem. The goal is not to sterilize it. The goal is to shift the balance toward bacteria that protect you and away from the 2 specific species that are eating your gum tissue right now. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and morning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was the same cluster of habits. And one of the most consistent ones, something I had never been taught in medical school, was something as simple as how Korean traditional medicine approached the mouth, not as a cosmetic concern, as a gateway to systemic inflammation. The oral hygiene practices, rooted in Korean tea culture, had a biological logic that Western dentistry is only now beginning to confirm. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you the specific compound in Korean green tea from the Boseong region, and exactly why it works against gum disease when standard oral care does not. The precise biological mechanism, how it selectively kills the two anaerobic bacteria responsible for periodontal bone loss while leaving your beneficial oral bacteria intact. The specific research, institutions, participant counts, durations, and measurable outcomes from 3 separate human clinical trials so you can verify every claim yourself. An exact daily protocol with dose, water temperature, steep time, timing, and the specific mouth rinse technique that delivers the compound directly to the bacterial pocket your brush cannot reach. The 4 preparation mistakes that eliminate the effectiveness of what you are drinking, including the temperature error almost everyone makes. Who needs to consult their doctor or dentist first, including the specific answer on blood thinners that most people never get. The active compound in Korean green tea, EGCG, which stands for epigallocatechin gallate. The most potent of the catechin family, works differently. Think of it as a key that fits only one type of lock. EGCG disrupts the outer membrane of anaerobic bacteria at concentrations that do not harm aerobic species. It is selectively toxic to the pathogens and selectively tolerated by the beneficial bacteria. The result is not a sterilized mouth. It is a rebalanced one. A research team at Nihon University in Japan conducted a controlled clinical trial over 8 weeks using a local delivery system that placed green tea catechins directly into the periodontal pocket. What that means for you: they put the active compound exactly where the harmful bacteria live. At the end of 8 weeks, there was a marked reduction in pocket depth and in the proportion of harmful bacteria compared to the placebo group. The minimum concentration required to inhibit Porphyromonas gingivalis, the primary species responsible for bone destruction below the gum line, was confirmed at 1.0 mg per milliliter. That concentration is achievable with a properly prepared concentrated green tea oral rinse at home. Picture the lining of your gum tissue as a seal, a thin, flexible border between your teeth and the outside world. When anaerobic bacteria colonize the periodontal pocket, they release compounds that trigger an immune response in that tissue. The tissue swells, softens, and bleeds. Over years, that chronic immune response, your body fighting bacteria it cannot fully clear, is what causes the progressive bone loss that dentists call periodontitis. EGCG and the related catechins in green tea suppress the specific immune signaling pathway called NF-kappa B, or nuclear factor kappa B, which functions as the inflammation broadcast switch inside cells that drives this gum tissue breakdown. When NF-kappa B is active, the tissue stays inflamed. When catechins suppress it, the tissue can begin to heal. A 48-subject randomized controlled trial, meaning neither the participants nor the researchers knew who was getting the real compound and who was getting a placeholder-tested green tea gel applied alongside standard dental scaling and root planing. Compared to the group that received only scaling and root planing, the green tea group showed measurable reductions in gum bleeding when probed at 3 months and reduced gum inflammation at both 1 month and 3 months. In plain language, the patients whose dentist also used the green tea compound healed faster and bled less than the patients who had the same dental procedure without it. A 56-subject, randomized controlled trial conducted over 6 weeks again, with neither participants nor researchers knowing who received the active compound-tested oral tea polyphenols, the compound family that includes EGCG. At the end of 6 weeks, the group receiving tea polyphenols showed a measurable reduction in the ratio of harmful periodontal bacteria compared to the placebo group. In plain language, consistent daily use over 6 weeks shifted the bacterial population of the mouth in a meaningful and measurable direction, not from a single application, from consistency. This is why the timeline answer matters. You will not feel a transformation in 3 days. The research confirms measurable changes at 6 to 12 weeks of consistent use. What you may notice earlier within 2 weeks is that your gums bleed less when you brush. That is the first signal that the inflammatory cycle is beginning to shift. This is the part most people never reach because they assume the protocol will be complicated. It is not. This protocol has one preparation, one dose range, one temperature rule, one timing pattern, and one explicit answer for people on blood thinners. No stacking required. First, your daily Boseong green tea. Use 2 grams of loose-leaf Boseong green tea that is approximately 1 heaping teaspoon per cup. Steep at 175 degrees Fahrenheit, 80 degrees Celsius, for 2 to 3 minutes. Do not use boiling water. Boiling water, 212 degrees Fahrenheit, 100 degrees Celsius, releases bitter tannins and significantly reduces the catechin concentration in your cup. Temperature matters. If you do not have a temperature-controlled kettle, bring water to a boil and let it sit uncovered for 3 to 4 minutes before steeping. Drink 2 to 4 cups throughout the day. That is approximately 500 to 1,000 milliliters total. Do not drink all 4 cups in a single sitting. Spread them across the day to maintain consistent exposure. Second, the concentrated oral rinse. This is the targeted delivery that mirrors what the Nihon University clinical trial used. After brushing at night, steep 3 grams of Boseong green tea in 250 milliliters, about 1 cup of water at 175 degrees Fahrenheit, 80 degrees Celsius, for 3 minutes. Let it cool completely to room temperature before using it as a rinse. Hold it in your mouth for 30 to 60 seconds, working it into the gum line, then spit. Do not swallow the rinse. Do this twice daily after morning brushing and after evening brushing for targeted bacterial suppression. Do not eat or drink for 20 minutes after the rinse to allow the catechins to remain in contact with the gum tissue. Sourcing. Look for packages labeled Boseong green tea or the Korean term Boseong nokcha on the packaging. Available at Korean grocery stores, H-Mart, and Korean tea importers online. For caffeine-sensitive viewers, decaffeinated Boseong green tea is also available and retains a meaningful catechin content. Do not use concentrated green tea extract capsules or supplements in place of brewed tea. High-dose green tea extract pills have been associated with rare but documented liver events in published case reports. Brewed tea is the safe, effective form for this protocol. This is not a case where more concentrated is better. Timing summary. Drink your 2 to 4 daily cups of brewed Boseong green tea spread throughout the day morning through afternoon. Perform the concentrated oral rinse after brushing, morning and evening. If you take iron supplements, separate them from any green tea consumption by at least 2 hours catechins, bind to iron in the digestive tract, and reduce how much your body actually absorbs from the supplement. If all items feel overwhelming as a starting point, begin with the oral rinse only for the first 2 weeks. One preparation, twice daily. The rinse delivers the compound directly to the target site. Add the daily cups in week 3, once the rinse is a habit. A note on blood thinners. If you are on warfarin, rivaroxaban, apixaban, dabigatran, or any other anticoagulant medication, speak with your prescribing physician before beginning this protocol. EGCG has mild anticoagulant properties documented in the published literature. For most people drinking 2 to 4 cups of brewed tea daily, the effect is minor, but if your clotting levels are being actively managed, your physician needs to know. The topical oral rinse, which is held in the mouth and spit out, not swallowed, is generally considered lower risk, but still warrants a conversation with your doctor. Contraindications: recent oral surgery, dental implant healing, or active periodontal procedures. Consult your periodontist before introducing any new oral protocol. Pregnancy high-dose green tea extract is not recommended. Moderate dietary intake of brewed tea is generally considered acceptable, but consult your physician. Liver disease history: avoid concentrated extract supplements entirely. Stick to brewed tea. Active dental disease that requires professional treatment. This protocol is supportive care. It is not a replacement for scaling, root planing, or surgical intervention when your dentist or periodontist has determined those are necessary. Chronic kidney disease: green tea at high intake levels increases oxalate load. If you are on dialysis or have been told to monitor your kidney function, confirm the dose with your nephrologist before starting. Active chemotherapy: EGCG has documented interactions with several chemotherapy agents, including bortezomib. If you are in active treatment, do not add any concentrated green tea protocol without clearing it with your oncologist first. But here's what the clinical trials revealed about why most people who try green tea for oral health see no results. It comes down to 4 specific errors. Mistake 1: brewing Boseong. Green tea with boiling water. This is the most common error, and it is completely understandable. Most people assume hotter means stronger. But at boiling temperature, the catechin molecules are partially degraded, and the cup releases more bitter tannins than active compounds. The result is a tea that tastes harsh and delivers a fraction of the EGCG concentration you need. The fix: steep at 175 degrees Fahrenheit, 80 degrees Celsius. If you do not have a temperature-controlled kettle, boil the water and let it sit uncovered for 3 to 4 minutes. The temperature will drop into the correct range. Mistake 2: using the oral rinse immediately after steeping while still hot. The rinse must cool completely to room temperature before you hold it in your mouth. Rinsing with hot tea does not increase effectiveness. It irritates already inflamed gum tissue and can disrupt the mucosal lining that the catechins are meant to protect. The fix: prepare the rinse earlier in the day or the night before and store it in the refrigerator. Cold or room temperature is correct. Hot is not. Mistake 3: taking iron supplements within 2 hours of green tea consumption. Catechins bind to iron in the digestive tract. This is confirmed in the published literature. If you are managing iron deficiency and taking iron supplements, drinking green tea at the same time significantly reduces how much iron your body actually absorbs from the supplement. The fix is simple. Separate your iron supplement from any green tea by at least 2 hours. Morning green tea, iron supplement at lunch, or iron supplement in the morning, and green tea in the afternoon. Either order works as long as the 2-hour gap is maintained. Mistake 4: stopping the protocol after 2 weeks because you don't see dramatic results. This one is the most expensive mistake on this list because it is the one that keeps people cycling back to whatever is not working. The 3 human clinical trials that confirmed the bactericidal and anti-inflammatory effects of green tea catechins measured their outcomes at 6 weeks, 3 months, and 8 weeks, respectively. In plain language, the evidence for meaningful change was collected at 6 to 12 weeks of consistent use, not 2 weeks. What you may notice in the first 2 weeks is reduced bleeding when you brush. That is a real early signal, but the deeper shift in the bacterial ratio below your gum line. The mechanism that actually matters for long-term gum health builds over months, not days. The fix: commit to 12 weeks of consistent daily use before evaluating the result. The bacterial balance your gums need to heal exists in your mouth right now. The beneficial aerobic bacteria are there. The infrastructure for a healthier oral environment is there. The question is not whether your mouth can shift toward that balance. It can. The question is whether you are giving it what it needs or whether you are continuing to use a tool that cannot make the distinction that matters. 1 cup of Boseong green tea in the morning. 1 concentrated rinse after brushing at night. Consistently. That is where it starts. Here is what we covered today. The 2 bacteria responsible for periodontal bone loss, Porphyromonas gingivalis and Prevotella species, live below the gum line in an oxygen-free pocket that standard oral rinses flood but do not selectively eliminate. EGCG, the primary active compound in Korean Boseong green tea, kills those specific anaerobic bacteria while leaving your beneficial oral bacteria intact. 3 separate human clinical trials confirmed this bactericidal effect and its downstream impact on gum bleeding and tissue inflammation. The protocol is straightforward. 2 to 4 cups of brewed Boseong green tea daily at 175 degrees Fahrenheit, 80 degrees Celsius, plus a concentrated oral rinse held against the gum line for 30 to 60 seconds after brushing. Measurable changes build over 6 to 12 weeks. If you are on a blood thinner, consult your physician first. Mrs. Park came back to me 6 months after that first conversation. She had started making the rinse the same way her mother had made it for her in South Jeolla province, steeped strong and cooled before rinsing. Her periodontist had noted at her 3-month visit that her gum bleeding had measurably reduced and the pocket depth at 2 sites had improved. She told me her mother used to say, "1 cup of tea is 1 dose of medicine." Her mother had been right. She had just needed the research to confirm it. If this information was useful to you, share it with someone who needs it. Not for the channel, for them. Someone whose dentist has been watching their gum measurements creep in the wrong direction and never mentioned that the tea tradition their Korean grandmother practiced had a peer-reviewed reason behind it. If you want to be here when the next video goes up, subscribe. This channel exists to reach people before they end up in a crisis that could have been prevented. Next week, I'm covering a compound that does something even more targeted. It does not just suppress inflammation in one tissue. It reactivates a repair system inside the cell itself that most people over 60 have lost significant capacity in. Researchers confirmed it in a Korean clinical cohort, almost by accident, while studying something else entirely. It has been sitting in Korean kitchens for generations. You will want to see it.